Yeah, it's really interesting when we talk about American Chamber of Commerce, which is a body or an industry body, as you have mentioned, which really caters to all the American companies which are operating on Indian soil. So when we're talking about AmCham in India, and especially in Hyderabad particularly, 3 years ago, there was a journey we have undertaken, I should say, as the industry stalwarts. We had this deep passion in terms of what is it which is impacting the society around or the communities we all operate and live in. And one of the key drivers we have understood to be is healthcare or lack of it. And that's stemmed the thought, it's not just about delivering our products or services from a business portfolio, it's also about the health and well-being of the societies in which we operate. And this is one area we as an industry should come together and really hold hands so that we create an initiative which has deeper insights from a thought leadership perspective. And that's where the healthcare conference, the thought has come in. So 3 years ago, we came together as an industry body, as I mentioned, and we started this initiative. And we have really charted the course to have every year, this is a national conference at a national level, and we're operating from India, Hyderabad. And the idea is to bring in everybody in the value chain or ecosystem of healthcare and bring in right from the medical practitioners, professionals, be it hospitals, caregivers, and the insurance organizations, governmental agencies, everyone who contributes for an affordable and accessible healthcare system. So that's the whole thought process, and that's our initiative in terms of as industry, we have joined hands in saying, and it's not necessarily that some of us who are operating under that banner, we're not looking at our own products or devices really. So it's not necessarily just with a business intent, but it's also in terms of how do we really create that value and impact to the societies. What have we done in this last 2 years? This is the third AmCham Health Conference. But the last 2 years, the first conference we've ever organized, what the output from it is going to be a white paper, which we submit to the, not just AmCham at the Delhi level, but also to all these stakeholders in the value chain, which means we're primarily talking to some of the key consultants, and we're also talking to the government. So we've submitted a white paper to the Government of India, where we have clearly reiterated some of the systems which can make it more effective and also accessible and affordable to the millennials, as well as a large number of the generations we have in India. So if we're looking at value and impact, recently there has been phenomenal amount of study in general from a sociological structure point of view. We all understand the sociological and the economic aspects when we talk about a country like India. But we also know we have a huge demographic dividend at this point of time, which is in our favor. At the same time, that is from one aspect. But the other one which we're all staring at, or which we would be staring at, is we have more and the lifespan is increasing, and we would have more individuals who are going to have these healthcare interventions which they would require, because they're all living beyond 70s and they're hitting the 80s and 100s. And this is what several other nations ahead of us, advanced nations like United States or Europe, right now are reeling under, because given their social security and various other things, they're still not able to cope with the phenomenal ballooning and the kind of increase in the pricing and the volumes which are coming in. So we will have to look at when do we hit that, and right now if we don't start thinking and we don't create that kind of a value and an insight to the organizations, I think we are going to be in a very scary times in future. We have some very interesting developments happening in this space. I have certain American companies right now looking at how do we customize and create a relevant kind of, could be a tool, could be a device, could be an app, which is relevant to the masses, as we say, which is again the mantra of affordability, accessibility, and awareness drive for India from a healthcare perspective. So whether you're talking about wearables, whether you're talking about creating those chips or apps which would be affordable and accessible to everybody across the economic divide, I think that's where we are in great talks as industry, one from a business perspective, but the other is also creating the value and the impact to the society. Yes. We have multiple ways of really contributing to generating and developing skilled manpower in India. So as organizations, we create the relevant benchmarks. That is one. So the way you allow the millennials entering into the industry. Then two is you also create through schools. So you go and touch base on the curriculum, you start hand-holding and talking to institutions, and you really tap into the collaboration between the institutes and industry. That's where you can see that the needle is shifting in the right direction, and we are creating the relevant kind of hand-holding on the skill gap assessment as well as addressing the needs for the future. The next move would be we continue to keep this passion and commitment towards healthcare as a very important initiative for the societies we operate, as I mentioned. And as an American company, being a responsible citizen operating in India, we will continue to work with the key stakeholders, that is government, and we continue to reinforce the message that healthcare is the center, and all of us have to contribute, not just with respect to blending in the information technology, because most of our companies are representing information technology. How do we bring in and blend it in with medical technology, as well as the devices we bring in, how affordable they are, how accessible they are, given the economics of a society or a country like India, and make it a win-win for both the companies as well as the government, and of course the people who are the important ingredients, or I should say components of the society.